All right, let's talk about Chapter 1. I hope you had a chance to read this in your textbook, but we're going to go over it, and then you're going to probably do a little adventure quest kind of thing just to reinforce it. This is just to get our feet wet with, what's going on in the current healthcare system today and kind of a little retro about our past. Here's some of the objectives. You're going to learn some terms. We're going to talk about socioeconomic factors that influence healthcare, and they do heavily, and some advantages of working in the healthcare field. We're going to talk about the career ladder because there's all different levels of healthcare providers, and many people in other careers that you wouldn't think of directly as healthcare providers, but are part of the process. They're a cog in the wheel, part of the healthcare team. There's a lot to consider when choosing an occupation. You guys are more focused on choosing a college right now and a career, but we're going to look in depth all year with this immersion model of New Vision to talk about what it takes to be any of these kinds of things, what it takes financially, what it takes personally, what it takes professionally to achieve the degree or the status or career that you want. And we'll talk about some of the advancements in healthcare too. We're going to talk about what has affected the rising cost of healthcare, maybe some ways to reduce costs, we hope, and some different types of healthcare services. Of course, in the past, we had, witch doctors and people who didn't know what they were doing. And then we had herbalists and a lot of people who were classified as witch doctors actually practiced this. And when using plants and natural methods of treating illness and injury and pain, it's interesting to note that we've come full circle. And now what used to be considered ancient medicine then became alternative medicine. And now it's parallel medicine. It goes right along with modern medicine. And many of the medications that are very common and have been around for decades have a plant base to them. They're not all cooked up on a stove with different chemicals. Of course, in the past, plagues and epidemics caused millions of deaths. We didn't know how to prevent those. We now have vaccines and all kind of preventative measures to prevent mass outbreaks once again. And just a little FYI, if you didn't know, Hippocrates is the father of modern medicine, and that's where the Hippocratic Oath comes that physicians take in order to agree that they do no harm. So here's just a little list of things that they've used in the past to treat things, and it's come back around. Like the bark of a willow tree actually is something they used to use for inflammation, and now we use aspirins and ibuprofen to reduce inflammation. And citronella and garlic repel bugs, and we still use those today. Eucalyptus is very common in treatments for upper respiratory infections and to clear airways. Foxglove is also part of the composition of digitalis that treats heart disease. We've started to appreciate the benefits of green tea for their antioxidant effects and also as a cancer prevention. Lavender oil treats not only cuts and bruises but also calms and relaxes people, and that's long-standing. And there's an awful lot of kind of attention being given to these essential oils like lavender oil, like lemon oil, which we all put lemon in our water to purify and make it taste better, and put a little honey in there, and that's very relaxing too. Tea tree oil is something that's not only an antiseptic in the past, but it's in antiseptics today. It's also in head lice treatments and that kind of thing. So what we thought we were very sophisticated with the onset of a lot of modern remedies, we found that some of the old remedies are just as good, if not better, than the ones that have been cooked up over the last couple of centuries. Currently, we really have shifted from contagious diseases and how to treat those to changing lifestyles, preventative health. So if you have an interest in taking care of people who want to stay optimally healthy, you might find yourself in this area of health and medicine. But we can do things now, we know, to prevent the onset of cancer, to prevent drug addiction and drug abuse, definitely heart disease and preventing those, limiting the risk factors to prevent the heart disease. The AIDS, of course, we took a look at that starting in the mid-'80s and then realized that this was a preventable virus. And tuberculosis. We thought that was going to be eradicated by the year 2000, but with the onset of AIDS and everyone's immune system who was affected getting knocked down, the incidence of tuberculosis rose. We also are looking very much at emergency response systems. What do we do if there's an outbreak? How do we prevent an outbreak? Currently, of course, besides the flu, which we'll of course all be getting the flu shot or wearing masks on rotation if you choose not to get a flu shot, Zika virus has been in the news a lot, and we'll take a look at that too and see how this past summer has done with that and how far into the United States that virus has been detected. There's been a great deal of flu and pandemics to watch, and these are just a few of them. This is out of your textbook, and I know the slide isn't completely clear, but we'll look at the Spanish flu of 1918 because it can happen again. We'll talk about the Hong Kong flu, which happened when I was in second grade, and I was sick in bed for 2 weeks, and lucky for me, my teacher lived 2 doors down, so I never missed an assignment. But then the swine flu, I was vaccinated when I was a junior in high school, and when we had the swine flu scare here maybe 7 or 8 years ago, those of us who had been vaccinated had immunity. And that pandemic that we feared back in the earlier part of this century didn't ever come to pass because of the measures we took to prevent it. It didn't become a true pandemic. So we'll talk a lot about the spread of infection and flu. This is just a little organizational structure. We have therapeutic and diagnostic areas of the hospital, then a whole brand new area that's become digitalized, and it's the informatics or the informational system to keep medical records, and then the whole environmental area that feeds and keeps everything clean in a hospital. And all of these different branches in the healthcare field, or in the hospital in particular, play an important part, and no one is better than the other. We have a lot of federal regulation. A lot of departments overlook this area of care delivery, and we're not going to get into all of the specifics of that, but there's the Occupational Safety and Healthcare Administration, or OSHA, which regulates the healthcare concerns by regulating infection control matters and that kind of thing. So OSHA is something you'll hear about as the year goes on. You've all heard of the Public Health Service, and that they'll take a look at those pandemics and tracking the flu and that kind of thing. It is one of our largest industries, healthcare. So when we talk about economics and government and how does that deal with healthcare, because you guys get credit for all of that, they're so intertwined. It's really hard to talk about healthcare without talking about the cost and about all the regulations. We have expensive healthcare because we have a lot of technology, but we also have a lot of malpractice suits because we are a suit-crazy, litigious society. We've lived a lot longer than generations that have come before us, and your age expectancy is into the 120s, so start saving now. And it's expensive to prepare for emergencies, so all of those things affect healthcare. The healthcare reform bills that have happened over the last 10 years have prevented people from being from not being able to be insured if they have a previous condition. And also with the Affordable Health Care Act, or otherwise known as Obamacare, industry business has to provide health insurance unless they have very few employees in their business. So until the Affordable Health Care, we had about 46 million people in this country without health insurance. It's very significant. That number is down quite a bit after the Affordable Health Care that required everyone to get insurance or to pay a fine when they filed for their income tax if they did not get health insurance. We have federal programs, Medicare and Medicaid, that are aid to the elderly and the disadvantaged. Medicare is a federal health program. It's for the elderly. Elderly need care. And some people with disabilities and who are in the end stages of their lives. And so that is a federal program that states pay into as well. So that's a large part of where people's tax dollars go. Medicaid is for the poor, low-income families with limited resources. And the programs vary from state to state. New York State has one of the richest Medicaid programs as far as services that it offers, but it also comes at a great deal of expense to the taxpayer. So aid is for people with low income primarily. That's the difference between Medicare for the elderly and Medicaid for the poor. There's lots of different health insurance options. Your assignment tonight is to go home and find out what kind of health insurance coverage you have. I want you to talk to your parents about it, and we'll have a discussion about that tomorrow. And we'll talk more about that. So I'm going to skip through these. HIPAA, this is the most important slide you will have to look at all year, because HIPAA is the Health Insurance Portability and Accountability Act. It basically has to do with patient confidentiality, and that's going to be a major concern for you this year. You are not going to breach confidentiality. What you see in the hospital stays in the hospital. If you see a baby be born, guess what? You can't go back and talk to your friends about what you saw. If you see someone have a heart attack, or need CPR on the table in radiology, guess what? You cannot go out of the program and talk about that. We will do some role playing, but it's very, very important because there is a lot of monetary punishment, and it will impact the chance of you having a career in health if you breach the confidentiality at any level. HIPAA also allowed people to keep their insurance coverage if they changed or lost their job, and that pre-existing conditions wouldn't be held against you. If you left a job and had diabetes, you'd still be insurable. You can't deny people the coverage because of prior illness, and it also mandates an electronic data exchange of information. So it's very important in relation to having health coverage, but also for healthcare workers to maintain confidentiality. So when you're thinking about choosing a career, you want to talk about not only something you're passionate about, but am I going to be secure, live the kind of life I want to live? What kind of responsibilities am I going to have? What kind of work environment am I going to be kind of stuck in? And what are my opportunities for advancement or to switch things up, new challenges, and of course everybody wants respect. And that should come with high education. So you've got different categories on the career ladder in health. You have aides that basically learn on the job or have little training, maybe 3-month certification classes. Assistants who have maybe a year of clinical preparation. Techs or technicians who have 2 years of community college or maybe come to a program like BOCES for 2 years and become a tech level. That would be like an LPN or a lab tech. A technologist usually has like a degree in chemistry and works maybe as a lab technologist or something like that, or a radiologic technologist that takes x-rays. And then you have the professional 4-year and advanced degrees above and beyond, like nurses and doctors and physician's assistants and that kind of thing. Just to give you an idea about who the modern patient is, the modern patient has Google, can look up their symptoms. They can take more responsibility for their own care. We encourage patients to get a second opinion, and every healthcare provider should encourage patients to do that. That shouldn't be a threat to you as a healthcare provider if someone wants to challenge your opinion. And also looking at other alternative and complementary medicine instead of just taking the prescription out of the doctor's office and running with it. There are patient rights, the Bill of Rights, and that is governed by the American Hospital Association. And there's nursing home patients have rights as well. I think that you probably read about that in your book. All programs that healthcare workers have certification or licensure have to be accredited, and these accrediting bodies rule with an iron fist. So that's when you get credentialing. You have to have licensure for most of the jobs you're interested in, or certification or registration, and the state of New York oversees that. The future of healthcare is going to focus on wellness, alternative medicine, care for us baby boomers, because that's the large part of the population, and of course technology. You have to not just be a specialist, you have to be multi-competent as a future healthcare provider. Be open to constantly learning and adapting to new technologies and working in a highly regulated field. So that kind of says what I needed to say about this. And then as you do your quest and and get a handle on the medical terms and things. We'll have more discussion when we correct the workbooks and so on. But this is just to get your toe in the water. Welcome to a career in health and medicine, or at least a decision that that is something you don't want to do. Thanks.